I now recognize Mr. Stauber. 5 minutes.
Thank you. Administrator Bedford, it's great to see you. I first want to thank you, Secretary Duffy, for the investment in the third oldest air traffic control tower in this nation at the Duluth International Airport. I am extremely excited to see that get built. It's going to help not only general aviation, commercial aviation, but we also have the 148th Fighter Wing, the F-16 group out of Duluth. That's a tremendous asset to our nation, national security, and our community. So first off, thank you for that. In December 2023, the FAA recognized the need to reform its current mental health policies and established the Mental Health and Aviation Medical Clearances Aviation Rulemaking Committee, or ARC, to identify barriers to mental health care for aviators and present recommendations to the FAA to address these challenges. The implementation of these recommendations was directed in Section 411 of the FAA reauthorization bill that we passed last year. Unfortunately, there was no required timeline for implementation, which is why I've introduced legislation along with Congressman Caston from Illinois, the Mental Health and Aviation Act, to ensure the timely implementation of Section 411. The bill also provides additional resources to recruit and train more aviation medical examiners. And I am grateful that this bill has passed the House and now awaits consideration in the Senate. Until such time as the bill is enacted into law, could you share what steps the FAA has taken thus far to handle the backlog of medical certifications?
Yes, sir, I can. Thank you for the question. I'm going to do a quick shout out to Secretary Duffy here for unlocking your air traffic control tower resources. And also put down a marker because everybody in this committee, I'm sure, has similar concerns with the obsolescence and the age of their facilities. They're woefully inadequate, terribly unsustainable.
Agreed.
And we do need additional funding to address it more comprehensively. As it relates to your question on medical certifications, I'm pleased to report that over the last 5 months, we've reduced the backlog of medical certifications. We had over 5,000 individuals waiting longer than 6 months to have their cases adjudicated and their medical certifications restored. We've reduced that number to under 300. So we've made great progress moving the backlog around. As a pilot, I understand these are vocational requirements that in order to keep our pilots certified to fly, we need to be more responsive. We've got new technology that that we're hopefully bringing to market in the first half of next year that will provide more clarity in terms of how we communicate and make the ease of medical certification, I'll call them exceptions, make those disputes more easy to adjudicate and work through the process, which with more clarity for both the user as well as for our medical team. But I do want to recognize just the heroic work that the staff in AV Medical has done in order to be responsive. More work to do for sure. Mental health, again, I was meet with the APA last week. I think they're pleased at the progress we're making in terms of identifying medications that can now be used without creating stigma.
That's extremely important because we know that 1 in 4 of us as adults are going to experience a mental health crisis in our life. It should not. We should be, when the pilots come in for help, that's a sign of strength, as you know, Mr. Bedford. So we want them to get the help that they need. It's going to help safety in the skies. It's going to help the pilot, him or herself, and it's going to help their families. That's why that's important. So I appreciate we moving forward on that. The last question is, the FAA recently proposed a rule on beyond visual line of sight drone operations. In the proposal of right-of-way rules, could you clarify whether the FAA has identified any potential safety concerns with the provisions that give unmanned aircraft right-of-way over manned aircraft? And just that last part of the sentence, unmanned aircraft, right-of-way over manned aircraft. I know it's a proposed rule. Can you tell us a little bit about that decision-making and why?
Yes, sir, I can. I think the BVLOS rule in and of itself is one of the more impactful things we've done this year to respond to the President's executive order to unleash drone dominance. If you understand how, and I'm sure you do understand how airplanes are separated, what we created essentially was a corridor where drones can operate safely, where they're essentially deconflicted from air traffic. You can imagine if we make drones actually transpond, it adds weight and reduces their performance capabilities. However, we can make drones recognize aircraft that are transponding and take evasive action. So in terms of right-of-way, essentially anything under 400 feet Drones do have right-of-way. Frankly, airplanes aren't supposed to fly below 1,000 feet unless they're on an approach to a runway. There are exceptions, however, when crop dusting, for example. Those are where potential conflicts exist, and those are the things where we're looking perhaps for some nuance to the current rulemaking process.
Thank you very much. I see my time's up, and I yield back, Mr. Chair.
The gentleman yields. I now recognize